Welcome everyone. So my name is Obed Figueroa. Diversity Premedical LLC is happy to present to you today another episode of Lessons Learned. Today we are here with Mrs. Antionette L.J. Charles. She is currently pursuing her medical doctorate at the American University of Integrated Sciences, while also earning her PhD at Walden University. Her past academic achievements include graduating from West Virginia University, earning a BA in Fine Arts. She then went on to earn her postbac at CUNY Brooklyn College. It's amazing achievements you have here. She then went on to graduate school at Long Island University, where she earned 2 master's degrees in medical microbiology and exercise science and nutrition. Her experience as a practicing doula for nearly a decade further inspired her to pursue her dream of becoming a doctor specializing in OB/GYN and a professor of clinical education. Mrs. Leonard L J Charles is also a wife, mother of 2 boys, a mentor, a public speaker, a women's health and a women's health advocate. Wow, that's a mouthful. So wow. Lots of achievements happening here, and we're so grateful to have you with us today.
Thank you so much. It's an honor.
So the value that I see, I wanted to explain to our audience as well. Normally we are interviewing practicing physicians, but I see such value in your conversation with you, because you have a lot to share. You've been quite active academically, also practicing as a doula, so I hope we have time to dive into that as well, so that this give them a deeper understanding of that. So thank you so much. Thank you.
You're very welcome.
The way in which I like to start is just as an icebreaker, if you will, to do like a minute or 2 of speed questions, just to get to know you beyond our conversation of the sciences and academia. So if you could just give me your first thought as we fly through these questions, okay?
I love these.
Alrighty. So your favorite car?
Chevrolet Equinox, which is the car that I drive right now.
Awesome. Favorite book?
Book was Grey's Anatomy.
Okay. Favorite color?
Coral, which is very similar to this color on my fingernails. It just makes me happy.
Nice. Favorite music genre?
Ooh, neo soul.
Favorite sport?
I'm gonna say football, but I also love swimming a lot. I did that most of my teenage to adult life.
Okay. Favorite movie?
Sex and the City.
Interesting. Favorite TV show?
Blackish.
Favorite guilty food or dessert where after you eat it, you feel guilty?
Godiva chocolate. The truffles. Yeah, always.
Favorite restaurant?
Carmine's in New York.
I like them too. Big platters.
Mm-hmm.
Favorite season?
So for beauty, autumn. For refreshment, spring.
Android or iPhone?
iPhone.
PC or Mac?
Mac.
So in high school, your favorite subject?
High school, my favorite subject was actually English.
And then in college, your favorite course? And that's a big span of time, but.
No, my favorite course in college was definitely painting.
Thank you. That tells us a little bit more about you. So again, you're married with children, with a blessing.
Yeah.
So how many years married?
I'm gonna get in trouble for this. 13? No, together 13, married 12. Okay, I got that. Okay, got it.
And your children?
My oldest son, Sheldon, he's 20 or turned 20 yesterday. And my youngest son turned 13 on Wednesday. So they're born in the same week, same month, 7 years apart.
Wow.
Yeah.
Awesome. Okay, so let's dive in. There's so much that I want to, you cover such a large span of activity, academia, doula practice. Let's start with, before we go into academia, I'd like people to understand about doula. What is that space, that working space, being a doula?
It's I like to think of it as a space where it's always existed since the beginning of time. No woman delivered a child on her own, whether it was, and the midwife always, or the physician always had an assistant. So as a doula, what our jobs are is to help transition the family from being a couple, or from being a couple to being a family. So whether that is helping them understand the medical jargon, understanding their rights as a patient, helping them further their communication with their physician, as well as providing them that safe space to deliver, well, not to deliver, but to labor at home for as long as possible. Because over the recent medical history of our country, women have become strapped to a bed, can't eat, can't move in the hospital setting. And it's very restrictive. And there's a lot of women that want the flexibility of being able to eat, labor at home, but aren't safe, don't feel safe, or don't feel secure about it. And my job is to give them that space. So I can't deliver babies, but I definitely understand the staging and movement for the different stages of labor. I help with massage and acupuncture to ease her pain. I kind of monitor how much food she's eating, what type of food she's eating, and kind of instruct them on different pain management methods that they can use at home. And then also, if the labor or the contractions kind of stall out, I have a couple of neat tricks in my bag of things to do to kind of move things forward. Mm-hmm. And then I go them to the hospital and I'm their support, because the partner of the person that's laboring also needs support, also needs questions answered. And if something were to go wrong, I have been in positions where the parents are in shock mode, can't really answer the questions that might be critical for a doctor, and I can give them that information because I've been there the whole time. So I like to think of doulas as your Siri of labor and delivery, okay, for both the physician and the patient. But I'm not there to intervene. I'm there to try to bring that relationship closer, to create a narrative and support between the two groups.
Thank you. Thank you for sharing that. So you're currently at American University of Integrated Sciences, pursuing your doctorate in medical education, at the same time getting a PhD. Please share, how is that life?
Lack of sleep. No. In the beginning, I thought it was going to be really difficult, but the concentration that I'm working on is health education and promotion. And really what it has done is shed a light on my medical education for me. It has shown a light on the importance of medicine, the importance of taking a good medical interview with your patient. So it doesn't take me too far from my medical education. What it actually does is make me go, oh, that's how those things coincide. That's how epidemiology works. That's how health policy is created. Okay, so me as a physician, I need to understand that it's important to do chart reviews annually, not only of myself, but of my colleagues, and they of me, because that's going to open up conversation to create policy within our practice, policy within our department that will trickle down to affect our patient care, affect our patient outcome. So I have found it very important to me, as defining myself as the physician that I want to become, which is a physician that treats the human first and the illness second. Because no one wants to be defined by their flaws. They want to be defined by other things that make them who they are. And this degree has definitely given me that opportunity to figure out how to navigate that as a physician, because it's not part of my everyday education.
Awesome. Thank you for sharing that. So, what I wanted the audience to also understand is your academic walk. I mean, your undergrad, your graduate degrees. Now you're in doctorate, level of education. And so, starting with your undergrad, could you share what your thinking was at that time? I'm wondering if there are those that can relate to that. And then, how did you move forward to really narrow in the sciences as your goal?
So I always wanted to be a doctor since I was 6 years old, which is a long time ago. I actually started undergrad as a pre-med at WVU. And as I found myself yearning to go party and be with my friends,
It's real.
um, I realized I was going to graduate college at 20, which meant I was going to be applying to medical school at 21, which meant I would be a doctor by 27. Something in me just was like, I still giggle when they say private parts, right? I don't think I'm old enough for this. And my two loves have always been art and science. I don't know, even to this day when I'm studying, I will draw pictures of what I'm trying to see. So that's always been a part of my life. So I kind of, to the dismay of my mother and the chagrin of my grandmother, changed from pre-med to art, because I was just like, I want to really have a life. And I was quickly seeing that I was too young. I was too naive. I was too green. I hadn't done anything but books, swimming, and school. And not to say that that's a bad thing. I mean, there's definitely a lot of people that can do that straight through and they are fine. But there was something in me that I wanted to do something else before I kind of jumped back in. And maybe that was a good thing, because my son came when I was 20. My first son came when I was 21. And soon after that, I was diagnosed with multiple sclerosis. So that was a little bit life-changing, not just being a mother, but being a mother with multiple sclerosis. And just navigating that and still trying to figure out who I was as a person, as a mom, and how I was going to balance all three things, right? So I went through, the phase of being the bohemian artist, doing art shows and all of that, never forgetting my science, never forgetting my love for science, never forgetting that I wanted to get back to that doctor, but I didn't know how. And it wasn't until, I want to say, I stumbled into being a doula that I was now around people that could get me back on that track. And while being a doula, I wasn't just a birth doula. I was also an antepartum doula, which means women that are high risk. So we do your food shopping, help you around the house so that you can be on bed rest. But I was also involved with women that made all different reproductive choices. So I was there for it all. Whatever choice they decided to make, I held their hand through it. And that was really powerful. And it really showed me how much I still wanted to be part of this community. And then, you meet the doctors, you talk to the doctors. And I also realized just how underserved the female population, no matter Black, green, purple, striped, was underserved, underappreciated, undertreated, underrecognized of their importance. So sat down with a couple of doctors at NYU that worked with the doula project that I was working with, and off I went. They were like, this is how you do it. And I was just like, okay, let's do it. I want to be there. I want to speak up for them.
I appreciate your honesty with that in terms of feeling that you just wasn't mature enough. Like I can just imagine that there's some people that may feel like that or can relate to that. And then, well, how do you then make choices that help you to grow?
To be a doctor doesn't mean you can't be anything else.
Hmm.
I, because I've wavered and gone back and forth, I've met people of all different specialties, and they're what is called the non-traditional student, which I feel like is becoming more and more traditional. Um, they've done so many other things, whether it's Teach USA or Peace Corps. Those doctors that I find myself in the same company with are the doctors that have these multiple perspectives and multiple point of views
Such value.
on what it is to be a patient. So I feel like I always tell students, all right, you didn't get into med school your first try? No problem. Take this time to do something else, anything else. Try anything else, because it doesn't take away from your focus of being a physician. It gives you a better insight and might in turn make you a better doctor for it.
Hmm. Hmm. That's interesting. Um, and so, I mean, when you think about the degrees, can you share with us little snippets of what you gained from each of the degrees? I mean, we already spoke about the fine arts, but going forward, like what did you gain from each, would you say?
So at Brooklyn College, I realized how much of a leader I really was.
Mm,
Uh, I was one of the founders or chartering members of the Brooklyn College MAPS chapter, which only started because Albert Einstein had this anatomy day and I wanted to do anatomy day. And when I applied, they told me, "Oh, you're not a MAPS member, so you can't do it." And I said, "What is MAPS? And how do I join?"
right.
And with the collaboration of the other chartering members of the Brooklyn College MAPS chapter, we were able to start an anatomy day at Downstate, which I think still happens. So learning my leadership skills and learning just how much I wanted to be there, how
Hmm.
much I want to learn as much as I possibly can.
Nice.
Um, and then my master's degrees, the medical microbiology, I think, was at first, I felt like it was my desperation, my yearning to want to be a doctor so bad and having already been turned down, wanting to do something that showed that, yes, you pick me, please pick me. But once I got there, it was maybe I should be, maybe the science side, the research is not so bad, and finding its place in medicine and why the two things are important and aren't mutually exclusive. As a physician, you have to be able to do research. You have to understand how to do research in a way that is going to be beneficial to your knowledge base as well as your exploration of patient care. Um, but I also took it as an opportunity to learn more about my own illness. So I
Hmm.
majored in immunology, and did a thesis working with this amazing PI, Dr. Christopher Roman, at Downstate doing molecular immunology. And that was an amazing experience. And then my exercise science degree was because through all of this, I was still a practicing doula. I had my own practice. So 2 times a month, I was attending either, I was attending a delivery 3 days a week. I was working at Bellevue with the doula project. So I was I didn't stop that.
Hmm.
What I was noticing was that women were lacking in their understanding of nutrition and exercise in their health. And doctors, though they spent all this time in school, I was quick to hear that it was 2 weeks worth of education. So I was just like, if I wanted to continue being a good doula, I needed to add an exercise, a nutrition portion to my practice. So that is where that degree came in. It was more for my practice as a doula, and wasn't quite sure how it would fit in as a physician until I heard that. So each one of my degrees have provided me these eye-opening insights on how I can, it's been a maturation process.
I feel it.
And then this PhD has really kind of stoked the flame of my interest in patient care and patient-physician communication and the patient-physician relationship, and how that plays a role in patient care, patient compliance, patient outcomes. Because if you don't trust the person that's telling you take this medication, what's the likelihood you're going to take that medication? If, and understanding that community and culture plays a role in that relationship with your physician. Because if your family has some medical trauma in their history, I don't care what ethnic group you are, as humans, we tell stories, and that stories become ingrained into our culture, into our identity. Mm-hmm. And if they experience a traumatic medical experience, like, for example, this is an extreme example, but one in which we're facing right now, Henrietta Lacks. 100 years from now, do you think her great-great-great-grandchildren are going to trust a doctor? Mm. No, because they would have known the story of their great-great-grandmother. Or do you think the offspring of the patients of the Tuskegee experiment, their moms, their aunts, their uncles knew what happened, and that becomes part of their family history?
Right.
So understanding how to repair that relationship, understanding that does influence, and how can you incorporate that communication into your patient care as a physician and not ignore it. And that's when I became interested in narrative medicine, which is a large part of my PhD studies at this point.
Yeah, I'm excited about what you're going to do as a practicing physician. I really am, because you've added such breadth to your experience. I appreciate that pivot that you experience. Although when anybody experiences it, it could be a troubling time because it's uncertain. But wow, the value that you show in those pivots in your experience, it's going to add such value. My word. Okay, so thank you for sharing that. What I wanted the audience to also understand, why I thought you bring such value to this conversation, is your insight to, as you mentioned, the MAPS, the SNMA chapters, the SNMA organization. So could you share that with them, what you understand MAPS value is to undergrad, SNMA's value to med students?
It's invaluable. It's priceless. So after starting the MAPS chapter, I ended up eventually becoming the regional MAPS liaison, which is the person in charge of all of the undergrads for the state.
What's the acronym for MAPS?
A Minority Association of Premedical Students.
Should there be an assumption that it's just only for people of African descent?
No, it is for the underserved and underrepresented.
Thank you.
So, and to be clear, it is the only student-run organization of all the medical associations. So the board of directors consists of medical students and pre-meds. So understand, these are people that hear you and know your story because they walked it. So MAPS for me was a support group of no other. When I didn't know what was going on in organic chemistry, there was a senior that was like, dude, use these balls or draw it out. And then this is, and walked you through it, because the tutors were not helping me. The school level tutors were not helping me. And the language that, you speak with your other MAPS members is one that is unique, and having that support. And then once getting into medical school, being part of the SNMA chapter was life-changing, because that transition from graduate school to med school, people think is easy, and it is not. What you used to do in a day or what you would do in a semester, you're doing in a week. And you're like, wait, oh, how do I start even to study this?
Yeah.
So, having that support to say, here are maybe some notes so that you can see how I did it. Maybe it won't work for you, but it'll give you an idea of how to approach this.
Mm-hmm.
And understanding, being able to ask somebody, why is it that I study well this way for anatomy, but I can't use this study skill for, histology and the rest of them? And going, you're right, you're not crazy. You can't study for them the same way. It is two totally different animals, and that is okay.
Mm-hmm.
But time manage myself. And then being able to be a regional director for SNMA.
And SNMA, that acronym?
Student National Medical Association, was also an amazing, amazing opportunity. But in all of those positions and all of that time in SNMA, what I found was just when I was burned out, just when I was at my lowest because it was piling on and I didn't know when it was going to stop, there would be a conference and I would be around 200, 300, or 1,000, depending on the level of conference, regional or national. And they're all feeling the same way. Mm-hmm. They're all just as burnt out. And to have that moment, that respite, that place to get a cold glass of water when you feel like you are on the third or fourth level of the hot place, really does rejuvenate you. It's 3 days for their National Leadership Institutes. It's 5 days for their national conference. Pick one per semester and go, vent, debrief, because these are people that are going through the things that you're going through and can tell you, no, sir, you are not crazy. That is exactly how this goes down. But this is how we can change it. These are how, this is, or just, this is how I deal with it. And maybe we could change it on the other end, or maybe we could change it now. And creating those plans, creating those policies, creating those programs. So with SNMA, as a national organization, they are connected to NMA, which is the National Medical Association. So we have mentorship from the time that you're interested, because we have programs for elementary school, we have programs for middle school, we have programs for high school, and then we have programs for college and graduate school or medical school, right?
And then supports when you're in the profession.
Right, and then supports when you're in the profession with NMA. Mm-hmm. I can't tell you how many moments I was in darkness and was just like, okay, I need to do something. Mm-hmm. to. And from all the years of my SNMA, I've created connections and relationships to tons of people, even yourself, mm-hmm. where I can pick up the phone or send a text message going, oh God, I can't. And someone will say, no, take a couple of days, think about it. Think about anything but school and then come back to it. It'll be fresh and new. And every single time, that is absolutely the truth. You're feeling burnt out because you've been so focused, so dedicated that you forgot you're a human. You forgot you needed care to care for yourself. So sometimes just having that group of people or even a singular person that you can count on to say, it's okay to sleep. It's okay to eat. It's okay to go to that birthday party of your favorite family member. It's going to be 2 to 3 hours of your day. It's not the end of your life. And neither is studying medicine. It should never be this life-ending moment. It should be this life-changing exploration about humanity and behavior and society. Because that's what we're treating. We're not just treating an illness. We're treating all of those things. So SNMA, NMA, MAPS, you learn that. You see that firsthand. And that's why I love them so much and appreciate them.
Such value, I tell you. And I too, as an administrator, as we previously mentioned or discussed, I see as an administrator in that space, when I was in that space, the value of just being around like-minded people that understand, that are fighting for the same things you're fighting for, can identify and relate to your struggles. Yeah, and just really just want to extend their hand out. Like, if you need me, I'm here. If you just want to talk, I'm
Right.
here. You know, it all matters. It all matters. Wow. So thanks so much for sharing. Is there anything else that you wanted to talk to before we close out?
Anyone and everyone, either already in the profession, on the journey like myself, to the profession,
Mhm.
or burnt out, stop, reach out, look up, and never feel like you're alone, because as much as you might think it, you're not.
Right.
And colleagues, whether in the profession, on the road, or about to start, are going to be your best allies, not your competitors. So rather than compete, help the people around you, support the people around you, and you will get the same support back.
Oh, there was one other thing I wanted to ask you. So along your journey, were there any engagements that you had where people were saying to you or suggesting, well, maybe this is too hard, maybe you should consider something else, you know, um, you know, eh, and how did you deal with that? How did you internalize that and to keep moving forward?
So definitely have the only child syndrome personality. So when you tell me no, that means yes. Or when you tell me I can't, that just means I got to find another way.
Mm,
But yeah, that happened a lot when I didn't get accepted to medical school or US medical schools the first time or the second time.
hmm.
They were like, well, you got 2 master's degrees. Just live with that. You've got a great doula practice. Just live with that. And I was just like, no,
It's not
no,
enough for you. It's not
no,
enough.
not me. I don't want just that. I want the whole caboodle. I want everything that's in my head to be a reality. It might take me forever to get there. I don't care. I just want, it is important to realize that just because someone says you can't and says no, doesn't mean that you're dreaming too big. It means that they don't dream big enough.
Mm,
So, as much as those same people that said no to me, I gotta tell you, will go to my LinkedIn page or will see me around or would have gotten word of mouth, because as you know, our community is small no matter what level you're on, right? And have gotten emails or text messages going, dude, you're still at it? Yes, I am.
mhm.
And that's okay. But they're impressed because I think they thought in telling me no, or I can't, or providing me with some other alternative would, placate the non-traditional student. I mean, because they really didn't want this. They went some other way first. And to see what I've done or what I've accomplished since that no reminds them and others that just because I went stage left doesn't mean I'm not going to end up on center stage.
Mhm, mhm.
It's just my path is different than yours, and that doesn't make it less than. It makes it equal or more than. Just my perspective is going to be different, and that's okay.
Yes, absolutely. I've seen non-traditional students, go on to be chief residents, in major hospitals. I've seen them start at, 30 in their 30s. I remember one starting out, I think he just turned 40, starting med school. He's a practicing physician. I've seen applicants that had low MCATs, go on to be successful physicians. I've seen them when they were told no with their low MCATs go on to do great things.
And that is, I guess, the point I was trying to make. Just because somebody tells you no,
Mhm,
that saying, there's multiple ways to skin a cat.
mhm, mhm.
So don't give up on what you have in your head because of somebody else's outside perspective.
Yeah. Wow. Thank you so much. Okay, so this is going to wrap up, but this again, thank you. You're valuable, valuable conversation. So I so appreciate you. So this is going to end this episode, guys. This is again Obed Figueroa from Diversity Premedical, and I'd like to give thanks again to Mrs. Antoinette L.J. Charles. I appreciate you for sharing your information with the pre-med students. All right, thank you.